And I would say that, it's honestly better just to be naked, take everything off, take the bra, take the underwear off, like let them look, because I had a patient who was wearing her bra, because most people do, but I moved over the bra strap and she had a little superficial basal cell.
Everybody forgets the power of the skin. So
the largest organ in our body.
That's right. So today's guest is a good friend of ours, an amazing celebrity dermatologist, Dr. Vicki Rapaport.
Oh my goodness.
Not to say my personal dermatologist and my go-to dermatologist. So we trust you as much as we trust anyone, and we are really honored to have you here. Welcome, Vicki.
Thank you both. I'm here to represent the medical dermatologists out there, as well as some of the cosmetic dermatologists.
Love it.
It's a rare breed. It's actually a dying breed, the medical dermatologist.
I actually had a patient that she made my heart sing the other day. She was leaving. She was checking out. But, you can hear them when you're in the hallway. And I was sitting at the nurse station finishing my notes, and she A-list celebrity, lovely woman, and she bumped into another A-list celebrity in the lobby. And she's like, "You go here too?" And she's like, "I just love Vicki. She's like a real dermatologist."
Oh,
you're like, yes.
I was like, "No, that is so cute." And I just
pretended
I didn't listen. I pretended I wasn't there. And I just kind of walked back into the room and it made my day.
Oh, it's great. That's amazing.
It's because you're trained. You go through this really kind of rigorous training to learn all the different conditions of the skin. And then unfortunately what ends up happening is a lot of people come out, it's not as lucrative and it's not as profitable to practice medical dermatology, especially in this area.
Right.
So a lot of people hang it up and they say, I'm just going to do injectables or just cosmetic dermatology. But it's great that you've kind of stayed true to the game. I'm just going to rewind everything and not look at the notes or anything. I know your father is a dermatologist and started this beautiful practice that you have now.
Yes.
Can you take us back and tell us how that all started?
Of course. Oh my goodness. Very exciting story. I grew up on the lap of a dermatologist. He would look at all of his medical journals on the weekends, and I would look at them and say, "Oh my God, that's disgusting. How do people have things on their noses?" It was always like big, huge skin cancers. And I didn't even think that I was going to go that route, but I guess I just was so used to seeing it all along as a child that it became kind of part of my life. And then when I was 16, I volunteered, and because I didn't get paid, in his office, and I would just basically file his charts, because it was paper charts back then, right? Oh my God,
Amazing.
The big, huge wall of charts that you'd roll, close, and you roll open.
Man,
and
I remember
took a
those.
whole room. It's like how the original computers took up a whole room.
Yeah.
The charting took up a whole room. And so he would let me come into the room sometimes and see surgeries. And the first time I ever saw him cut out a basal cell on a forehead, I was really excited to go in there. And then all of a sudden I saw the nurse escort me out. I don't know why. And I said, "What's wrong?" She's like, "Oh, you started to turn green." I said, "I did?" So I guess it was sort of surprising. Even though I thought I was prepared, I wasn't prepared.
Definitely.
But the second time, you're better. The third time, you want to do it yourself, right? But I was only 16. So then when I went to college at UCLA, I had to declare my major as a junior. Now you have to declare as you enter, right? When you're applying, you have to declare your major. We only had to declare as junior. So I remember the night before I had to declare, I said, "I think I'm going to be a doctor." And it was like a light bulb went off in my head. I wasn't actually pre-med yet. I was art history major. I loved art history. I wanted to, but then I thought, what am I going to do with an art history major? Be a docent be some kind of excavator of ruins? No. So that night I decided to be a doctor, and it was just full
Game changing.
Yep, full speed ahead after that. And then I volunteered in his office, more and more, and realized maybe derm would be the thing. So when I went to medical school, we finally got to the histopathology at derm section. And I remember I couldn't stop, reading the books.
That's awesome.
I was, when derm, you just do in medical school, you kind of do your bare minimum because you're just so overwhelmed. I wouldn't say your bare minimum, but you're reading, there's so much to read.
You're just trying to stay
You're just
afloat.
trying to memorize. But in derm, I was like, I need to see more. I need to read more. And then I knew I was going into derm.
Amazing.
After that.
I mean, look, it's so interesting because when you think about it, most internal diseases they essentially present themselves with some type of skin issue. And that's why, derms are real physicians, right? It's amazing. When did you, or I should say, each one of us, when you come out, you feel like you're on top of the world, you're the smartest you're ever going to be. And then you kind of develop your own niche. How did you go about that, journey?
I'm kind of an unusual dermatologist. I like honestly everything that derm has to offer. So, diseases of the hair, skin, and nails, I don't super specialize. And as I've gotten older and older, I realized maybe I should have super specialized, because now there are things that I actually really do like. But then I can just tailor my schedule to those types of things. But I am not the kind of dermatologist that is just doing cosmetics.
Yep.
And same, as you were mentioning earlier, I would not be fulfilled just doing cosmetics, although I do love it. I love the injectables. I love the lasers. I love seeing the medical, because the medical dermatology to me is the most interesting. And also you feel so much like pride in helping them. Hopefully we can talk about some good cases later.
Absolutely.
But, it doesn't make a lot of money, but I don't really care. I see these people with, full 100% body surface area of eczema, and then you clear them up with these new injectables that we have, and they think you're God. And it's like, I just wrote a prescription, but I know how to consult you on the medication. I know how to, teach you about the potential side effects and how to keep you safe, but you can go live your life.
Yeah.
And I just love that. I
And
love
it's
rashes.
interesting, 'cause a lot of it has changed over the last, especially with AI and technology and the advent of new medications. I mean, some of these biomodulators are changing people's lives for psoriasis and for eczema and for skin conditions that have been autoimmune that we haven't been able to really treat. You have them do red light or whatever, but it would never really kind of get rid of it.
And the medications have become so safe. I think dermatologists, we've always been so sort of afraid of these systemic medications because they were riddled with side effects,
Sure.
right? Remicade and all these things that the rheumatologist would prescribe for lupus. And finally the meds came out with zero side effects.
Yeah, it's amazing.
You don't even need to check blood work in some of these injectables for psoriasis. You see them once a year. It's like,
so cool.
You miss these patients. And then when you see them, they don't even have rash. So you just need
cool.
to check blood and refill their prescription. So, but then these patients become less interesting when they're so clear. Then of course you want to see more. And
Exactly.
then maybe you do want to go into the next room and do some fillers or some lasers.
Right.
But I really do love the medical part, because also if we're going to talk about cosmetics, they convert into doing cosmetics because they trust you.
Of course.
Absolutely.
You treated their kid who was 6 months old with terrible eczema, and now they want to, see you maybe for their Botox or their fillers or their lasers.
For us, obviously, we love sending you patients because, there are certain things that we love doing and but there are certain things that, sometimes it's outside of the scope of our practice, and there is an intersection between plastic surgery and dermatology. Acne is such a huge issue. We have teenage patients and even young adult patients that come in and either are currently suffering from cystic acne or they have suffered from cystic acne. And now we're supposed to, try to make them look better.
Yeah.
And the interesting part is when you look at an adolescent going through this, to have severe cystic acne completely changes the trajectory of someone's entire persona. And so it's so important. How do you usually, start with treating these patients?
I'm so open with them in terms of what I see the plan is going to be if they don't get better quickly. So let's talk about the severe cystic acne patients. I feel like there's a certain kind of patient that's ready to start on Accutane, and there's a certain kind of patient that doesn't even want to mention that in the room. They're so afraid for whatever reason. So depending, we grade acne, mild, moderate, severe. If it's mild, you just have to explain them. Maybe it's hormonal. Maybe we need to do some kind of hormonal, either birth control or spironolactone or some topical. Moderate, add an antibiotic. Oh, I don't want to take an antibiotic. Okay, there's 50% of people that will and 50% of people that won't.
Right. So hard to practice in Beverly Hills.
Right? And then the severe, it's like you need topical, you need oral, and then let's talk about, Accutane, and if you're not better in 6 to 8 weeks. I love the patients that are game to try everything and anything, because there isn't just one thing. Right. It's not like, just change your diet, stop drinking milk and eating gluten. That doesn't work. I have the healthiest patients who have the healthiest diets, and they still have acne because it's genetic and hormonal. Mm-hmm. But of course, we treat them until the acne just decides to stop on its own, because that's basically what happens. Mm-hmm. We get it clear, we keep it clear. Sometimes if they stop the treatment, it will come back because it is just in their genetic predisposition and whatever age they are. But you just have to explain to them. I'm not the kind of doctor that says, take this and I'll see you, in 6 weeks. I explain to them, if this does not work, we're going to give it, you need to give it 6 to 8 weeks. You really do. I mean, all the medications that are FDA approved, it's a 12-week study. So really, we should see them in 3 months. Right. But patients don't have that patience.
Yeah,
so I see them at the mid mark, the 6-week mark, and then the 12-week mark, and then we can, get more advanced treatment or stick with the plan if it's working really, really well. But I feel like there's not one answer to how to treat the acne.
Patients that come in and because I've seen amazing success stories with Accutane, right? What is a reservation of using Accutane? Educate our listeners on Accutane. And a lot of people think it's like this horrible drug that shouldn't be taken, and it really isn't. It's actually relatively safe, especially for the 20-year-old that's not going to have a baby right away and isn't sitting in the sun all day long. So kind of let our viewers understand how Accutane is a great way to clear your skin in a very effective way and relatively safe if you do it the right way.
Of course, and Accutane is something that we learned like the first day in the dermatology residency, because it is a game changer. It is a miracle. And when I put a patient on Accutane, I feel like my job is done. It's kind of insane. It just does all the work for us. But basically, the story with Accutane is that it's high doses of vitamin A. And what do high doses of vitamin A do? It just kills the oil glands. But it can also dry people out in different places. So I explain like the head to toe potential side effects, and they're so rare. But I explain to them so that they can remember, oh, I heard that. She said it was going to be fine. And so dry eyes, from head to toe. Dry eyes can happen, dry lips can happen. And I say if dry lips don't happen, maybe you're not on the right dose. So expect dry lips. Have some Aquaphor in every pocket. They have that stuff anyway, right? It's all over TikTok.
Right.
Belly pain, achy joints, achy back. We don't really know the reason for those side effects, but if those happen, if belly pain happens and it's undesirable and it's really not stopping, then you stop the medication. And I also remind people God forbid, they have any serious side effect, you stop the medication and everything goes back to normal. Nothing is a permanent problem. Nothing is a permanent change. So achy back, achy belly, and then feeling down, feeling sad, feeling depressed. So it can bring out depression in somebody who's prone. It does not cause depression. It does not cause somebody to all of a sudden want to commit suicide. So the answer to your question is, I don't know why people have such a hard time with Accutane. And, it's like anything online. They're going to, it's confirmational bias. They're going to go and listen to the thing and believe the thing that they want to believe in.
Right. Yeah.
But I have seen some amazing positive journeys.
Yeah.
But there are some positive journeys out there that people are positively describing Accutane. And I thank God for those people, because when I see scars for acne, I think this person is going to have a hard time. And they think they can just do one laser treatment or inject a little bit of filler into the scars or do subcision or do dermabrasion, not dermabrasion, right? And of course, it takes years for the acne scars to go away. I had the most amazing situation. I had an employee with pretty beautiful skin. She was older. And she's like, oh, I had terrible acne scars when I was a kid. I said, you did? Tell me what you did, because whatever you did, I want to have in my practice. You ready for what she did? She got a facelift. Because it was the only thing that would have helped.
It was the only thing. You're right.
That's
Yes.
so interesting.
Again,
right.
she was older. She wanted a facelift anyway. But it was the one thing that actually helped her.
You're
because
right.
everything else is just okay. We can help acne scars maybe 50, maybe 80% better, but we can never make them 100%
It's interesting
better.
because you literally took the words out of my mouth, because treating acne before it gets too bad and before it turns into scar is a lot better, because I know that over the years we've treated a lot of acne scarring, whether it's with Morpheus or fractionated CO2 laser or dermabrasion or peels or subcision and injection, and there's so many ways to treat it. It never goes back to normal, ever, ever, ever.
Yes.
So treating it early and going to a medical dermatologist and listening to them and really following the plan, I think prevents the need to have treatment to fix the scarring, which is really difficult.
Well, and I think that some parents are oblivious to the fact that it is actually scarring. Oh, no, that's not scarring. That'll go away. How is that not a scar? It is a dip.
Yeah.
Some young kids with acne, though, the dips and the bright red, areas will heal because they have, so much amazing growth factors, right? And their bodies are just so incredible. So, I never want to put that onto somebody like, oh my goodness, you're going to have scars forever. I do mention, I always mention in my note, because if they ever come back to me and say, hey, why didn't you mention this to me? I said, you did. I did.
Yeah.
Remember? They never remember.
Right.
But I'm very clear.
No,
I'm always very clear about, like, I'm worried about scarring. I spoke to them about scarring. And I just even had a neighbor who, texted me the other day. I'd seen her daughter and she's like, oh, my daughter thinks she has acne scarring. I don't think so. And I said, let me go back and look at my notes, because I haven't done it yet. I haven't gotten, because it's just happened this weekend. But I bet in my notes I said I'm worried about scarring. And how does the mother not remember that? I don't know.
Yeah.
They just don't hear that.
Because they don't want to.
They don't want to.
They don't want to.
But Accutane, as a summary, Accutane can help with scarring. Of course, it clears them up. They barely even have to wash their face.
It's amazing.
They're not on any other medications. That would just dry them out. It just hopefully prevents the potential scarring as well as to clear up the acne.
I mean, listen, we see the trajectory of someone's confidence change so rapidly once they're treated because it keeps them from doing normal social things.
Yes.
I definitely want to solidify this for all the viewers and listeners, moms, dads out there whose kids are suffering from acne. Again, consider this as not necessarily a last line of treatment. Sometimes it's the only line of treatment. And because obviously once you do have these types of ice pick scarring, these acne scars, it's virtually impossible to eliminate them to the point where you feel comfortable with your skin again. So I would treat early, treat aggressively, and, this is where Accutane plays into, appropriate and effective treatment. For us as plastic surgeons, obviously, our concern with Accutane is now, when do we operate with someone who's on Accutane? And it used to be that the original guidelines were you couldn't operate on someone within a year of Accutane. And then it was 6 months. And now it's 3 months. It shortens it. And I don't know. I wonder if it's literally the cycle of collagen stimulation that is the determining factor. So maybe 8 weeks. 6 to 8 weeks.
The longer, the better.
Yeah. Well, look, what we're saying is that it used to be this big fear. Now it's becoming shorter and shorter, so it's not as big of a surgical risk for us. But what would you recommend? You're speaking to us and you say, let's see. Well, how long should we wait before I complete that rhinoplasty?
You have a girl that's 23 years old, just finished Accutane, wants a breast augmentation or a rhinoplasty.
Okay.
How long should they wait?
Really good question. So very important to remember that somebody can actually get pregnant a month after their last pill of Accutane. So it really is pretty much out of their system.
Well, that's interesting.
But the healing is very interesting. The slow healing time that Accutane does cause, you can tell when people on Accutane, they get a cut and it takes 10 weeks to heal. Okay, I'm exaggerating. Maybe 3 weeks to heal when it would have taken 10 days. If it's an elective procedure like a rhinoplasty or a breast augmentation, I would tell them to wait a minimum of 6 months because it's cosmetic. I have had many patients who have needed some emergency surgeries, gynecological surgeries, other surgeries. The younger, the better in terms of how quickly you can do the surgery. But I specifically just said, look, you have to just explain to your surgeon that you've been on Accutane and this is the day you stopped. They need to decide. And they've had emergency surgeries and they've did perfectly fine. So I think it's having the conversation and going with what you're comfortable with. The younger, probably the better in terms of rushing into it. But of course, if it's elective, I would wait minimum of 6 months.
I normally do 6 months. What do you do?
Yeah.
6 months?
Yeah.
I
That's
normally wait
safe.
6 months.
Yeah.
That's why we like each other, because we all agree.
Yeah, conservative.
I just call you. I'm like, what do you think?
Yeah. I'd rather err on the conservative side.
So let's kind of go on from acne to something that everyone wants to know about, and that's skin cancer. And things have changed. Again, technology has changed things. And I just read the coolest thing, this app that you could take pictures of moles. But let's pretend that that's not around.
Okay. Thank God, let's pretend.
I mean, it was really, it's the coolest thing. It's called the Derm Scan or DMX something. I mean, it was unbelievable. But let's just say, when should people start getting full body checks? Like, what age is appropriate?
If somebody has a lot of moles, I'll see, a 1-year-old, a 2-year-old, a 3-year-old.
Okay.
Does a 1-year-old, 2-year-old have a lot of moles? No, but they can have 1 or 2 big ones that pediatricians are not comfortable with. So generally speaking, if the pediatrician isn't comfortable evaluating like a congenital nevus or somebody with a lot of moles, I'll see young kids. Okay. Generally speaking, in your 20s, you should probably start having mole checks because we see 20-year-olds with skin cancers. And when I say mole checks, it's skin checks. We're not just looking at their moles. We're obviously looking everywhere. And I think it's really important to go to a dermatologist that does a thorough skin check. So, my colleagues out there some of them are amazing and some of them suck. I had a patient who came in to see me and I asked, why did you change? He was in his 30s or 40s and he'd been getting mole checks every year. And he said, well, the doctor that I have been going to does a mole check from 5 feet away. I said, what? Yeah, he does the mole check standing against the wall and he tells me to hold up my feet. I said, well, I'm really glad you're here because we're going to do a thorough mole check on you. Wow. So yeah, it wasn't his interest. This guy's into laser. So also know your dermatologist. If they're into it, You got to check in the scalp. You have to check in between the toes. All the things that we do. It's so easy. It takes seconds.
You don't want to pull a Bob Marley, right?
No more. Poor Bob Marley. But he knew he had it. He decided that he wasn't going to treat it because he doesn't want to play because it would
want to play soccer.
Yeah, exactly, right? From the movie. Oh, so sad.
But he had for those that don't know, he had a subungual melanoma, which means he had a melanoma that was under his nail. Very hard to find, especially on an African American male.
Correct.
Because everything is darker, so it's hard to see. It's a killer, and those are. The treatment is always varied. I remember when we were talking about it when we were doing hand surgery is what do you do if someone has a melanoma of the finger? Do you go just, proximal to it? Do you go to the next joint? But that's a whole nother discussion. But those things have to be checked because it's very, very easy to miss. And if you don't go to a board certified dermatologist who actually enjoys doing this stuff and doesn't do it for 5 feet away, easily these things could be missed and they're easy cures if they're caught early, right?
Right. And I would say that, it's honestly better just to be naked. Take everything off, take the bra, take the underwear off, let them look, because I had a patient who was wearing her bra, because most people do. And I always just, ask if they're comfortable in looking everywhere. And if they're not, I don't. That's fine. But I moved over the bra strap and she had a little superficial basal cell. And if I hadn't moved over the bra strap, I always move over the bra straps, especially on the back. And it was fine. We caught it early. We sprayed it. It was fine. It wasn't even that big of a deal. So I think that if anything doesn't look normal to, having your own, being your own advocate is also very important. I think people look at themselves a lot these days, a lot more than they ever have.
Definitely.
They should continue to look at themselves a lot. They should stand in front of the mirror naked. If something doesn't look normal, a weird color, a weird shape, it itches, all the things that we say over and over and over again, people know that something isn't normal on their skin. They continuously itch a spot.
Yep.
Right.
Go show somebody. It's so easy to take care of if it catch it early. So back to the answer to your question, start in your 20s. I do think that people do wear a lot more sunscreen in general, but I don't think they wear enough. And I actually have a little UV camera I'm going to show you guys about to see if you have your sunscreen on, to see if you have your sunscreen on. But basically,
I'm the worst.
You're the worst? Okay.
Convertible for the last 30 years? Yeah.
If you were my patient, you had a convertible, I would fire you.
Yeah. Literally for the last 30 years.
Oh my God.
Oh yeah, no.
Do you have
I'm
a hat?
Not that old, guys.
When you drive, do you wear a hat?
No.
Oh my goodness. Oh my goodness.
I let the Middle
goodness.
Eastern genes kind of help. There's one thing that I find fascinating. As for treatment for the different types of skin cancers. Now, melanoma is a little more aggressive, so that always has to be excised. But for other ones, treatments have changed a bit, right? And I think now we have ways, and this is, again, for the listeners that are listening, this is really important because a lot of people think that if they have a little spot on their nose, you're going to have to cut the whole nose off. And that has changed significantly over the last 5 to 10 years. Yeah. And Mohs surgery is not as much indicated. And I'm not going to answer all these questions. I'm going to let you do it. But how much do you trust some of the topical chemotherapeutic agents? How often do you use them? And what are your thoughts on them?
So, back to that photo when I was a kid, sitting on my dad's lap with that open journal and that big gnarly growth on the nose. Who lets something grow that big? Yeah. Something that big, obviously
exactly.
The county.
You would see it. Yeah,
you go to Cook County, LA County, any county hospital, you see all of those.
Right. I mean, we live in a bubble, right? It's a political bubble, a medical bubble, whatever kind of bubble you think. We live in LA where people come in with little tiny bitsy things. So yes, catching things early is really important. I love the topical chemotherapy. So, when we talk about that, some of them aren't even really chemotherapies. They're immunomodulators like Aldera, Imiquimod. Sure. These prescriptions work beautifully. I think it's hard because you use these topical things on the right patient for the right size lesion, obviously something small. And if it's reacting well, we continue. But there isn't really a protocol as to how long to use them. But I have a patient right now who has what I think is a basal cell. We don't even really truly know because we didn't want a biopsy. It was right in her glabella. I didn't want to leave a scar. I said, look, let's try Aldera. If you get a reaction, most likely there's something going on because Aldera will not react if there's nothing going on.
You mean it just turns red, right?
Scabby, red, oozy. Yeah. They hate it. The patients hate it. She hated the reaction. But I looked at the before and after and I said, do you understand how well we've come, how far we've come? It was 90% better, but it wasn't gone. I said, you need to do it again. And she said, I can't do it again. I said, well, then we're going to have to do a biopsy. Do it again. Let's see if you get a reaction. If you don't get, and usually the more often you do these quick little course sessions of Aldera, the less reaction you get. But it is hard to do these medications too because nobody has any downtime, right? They don't want downtime. True. But it's better than a Mohs surgery and a big scar. Although I do love Mohs, don't get me wrong.
Sure. Likewise.
The Mohs surgeons saved my life, all day long. But if you can catch things early, topical imiquimod, there's Clyceri, there's Effudex, of course, there's diclofenac, there's a couple of them, but my preference is imiquimod.
And what are your thoughts on like the new paper that just came out, I don't know, about a year or two ago about fractionated CO2 laser and having that treating superficial lesions and using peels and things
or the 50%
like that?
reduction in
I would combine them with the topical medication because I feel like you don't really know until 3 years later when it grows back, and then you're like, oh God, it grew back 10 times bigger.
Makes sense.
So I feel like the combo would be great. But I think laser assisted, treatment of skin cancers is great. And then you mentioned about the AI, about the scans and the moles. And eventually AI is going to take over derm, is unfortunately what I think. Like you'll take a picture, the AI will be so good at it that they'll be able to tell you what it is and how to treat it. Now, of course, we still need doctors to treat it.
Sure.
But if it's a topical treatment, they'll spit it out in a vending machine. And there you go. There's your prescription.
Yeah,
but,
it's
so
fascinating.
the scanning apps are okay. They're not perfect yet, but they're getting better. So I wouldn't, super trust all, take photos of your moles and send it in the app and have them say yes or no, because God forbid it's something that is terrible and they're telling you no, it's perfectly fine. I still think they need a full body skin check.
I agreed.
I know that we sometimes, if we're questioning a lesion, we'll send them to your office because you have a way of evaluating to essentially, I can't remember the name of the instrument, but what you do
The
is
dermatoscope.
Yep. But you take a look to see if it actually is a potential basal cell or something like
Right.
that.
Does it light up if it is? No.
Does AI tell you that it is? AI says this is a basal cell. Dermatoscopes came after my residency. So I had to learn on the job, so to speak. And I think, you get really, really good at it. I don't know how I practiced dermatology without a dermatoscope in the past. Now that I have it, I look at everything and I can feel so comfortable. There's certain patterns you see. It's just very, very, very magnified. And if the pattern is perfect, then you're like, oh, that thing's fine. If you have any suspicion, because you learn, about the certain patterns, and if there's something off, you just take a little biopsy. But it is so helpful.
Yeah.
The naked eye, I don't understand how people do it with the naked eye.
Now, you mentioned something that was pretty interesting a minute ago, that a lot of people are using sunscreen a lot more. And you feel like they're a lot more cognizant of the fact that they have to use sunscreen and don't sit out and bake like I used to when I was in high school, and we used to use olive oil and all sorts of weird stuff, honestly. Like baby oil, and just sit there like just bake in the sun. Have you seen a decline in skin cancer? And if you have, what have you seen a rise in? What are you seeing more of lately? Are you seeing more shingles, for example? Or are you seeing other skin conditions like eczema or psoriasis due to maybe foods or anything that's gone up versus something else has gone down?
Oh, it's such a great question. Unfortunately, we have not seen a decline in skin cancers.
Is that global warming?
Pardon me?
Because of global warming? Yeah. It's so hot. It's always hot.
I think it's because people wear sunscreen on their face, but they actually don't really wear it that much on their bodies. And so they're protecting their moneymaker, and they're out there baking. And so the numbers of skin cancers are rising. Will they eventually plateau and go down? Maybe with this next generation that's, on TikTok and buying products at 10 years old and wearing maybe better with sunscreen. Because it's really, we haven't seen those effects yet. It takes 30 years.
Yeah, the damage is already done when you're, by the time you,
right?
I have patients that come in all the time and the extremely damaged skin, and they'll say, well, I always wear sunscreen. I put it on 2 to 3 times a day. I said, look, that ship has sailed. I mean, you
Skin
did
looks
this
like
in your
leather.
teens and 20s.
Right.
And now, the DNA has been damaged. There's no going back.
And of course, I want to encourage them to continue to, and I don't want to discourage them and say, don't bother, because it's still important, because in the next 30 years, you're going to exponentially have more damage if you're not careful.
Definitely.
But I really, truly also believe that the sunscreens aren't perfect. That's why people come in at the end of the summer and they're very tan. But I wore sunscreen all day, every day. Well, they're not reapplying, and I'll show you in the this little camera that 3 hours later, it's basically gone. So it depends on the sunscreen. In some, it's 2 hours later. So they're not reapplying, and they're obviously getting tan. And there's just a certain amount of UV rays that are never, ever, ever, ever protected by any sunscreen.
Sure.
That's why I love the clothes. I think that, everybody wants to wear bathing suits, but you really need to cover up when you're out there. You need to wear the long sleeves. And, wear the bikinis at night. Why not?
Wear your bikini at night.
Wear the bikini at night.
I like it. Mankini. All right.
He doesn't know that at the end of this, you're doing a full body check on him. I just volunteered.
For the viewers, we're adding a little something special today.
But he's way too tan, so I'm going to have to give him some heat.
This isn't tan.
Oh, this is not
It's just
tan
a
for
tiny
him.
little bit of dirt.
The interesting part is obviously we know how bad certain portions of the sun can be, right? UVB, definitely. UVA for, more aging and things like that. But there's a certain amount of sun that's good for you. And then after that, it's when you have that rapid, it kind of falls off the cliff.
Yes.
And so obviously, it's good for the body, a little bit of vitamin D and things like that. But beyond
That's right around my drive.
Yeah.
Convertible, 20 minutes a day.
Yes.
I mean, the dermatologists have a position on that. Do you want to hear about that?
Yes.
Okay, sun is amazing, right? But if you don't want to have a wrinkle, a freckle, a brown spot, any kind of aging whatsoever, 0 sun is what you're supposed to get.
Yeah.
So if you don't have an absorption problem, you can get vitamin D, through food, through supplementation. If you have an absorption problem, yes, you probably should get a little bit of sun because it's very efficient the way it converts. I had a patient who came to me and said, well, I look into the sun every day for however long, 1 second, 10 seconds, whatever, because, I've been told that that's really, really good because something about the circadian rhythm. And when you wake up, you're supposed to look into the sun.
Yes.
And I said, you're never supposed to look into the sun. And she basically said, I don't care what you say. And so she wasn't going to listen to me about the sun. Next, I was going to have a discussion with her about the sunscreen. She wasn't going to listen to me about that, let alone listen to me about looking into the sun. So yes, sun is amazing. We love the sun. I'm a gardener. I'm a farmer. I have a farm at the house. I brought you my passion fruits. I love the sun.
So
I need the sun. But I think that if you can really just get the tiniest bit of sun, then that's okay, like 5 minutes. But you're getting it anyway by living in a sunny climate. If you don't live in a sunny climate, you should seek it out. But I also remind patients, just do a different body part. If you're really going to just do it and you're not going to listen to the science and to the positions of the derm, different body part every time you go out there. Don't always do your face. Don't always do your body. Do your legs, do your feet, do your back. Expose different parts, and that's safer.
Along those lines, now we're talking about some of the damage from the sun. We've discussed acne. We've talked about skin cancer. One of the other skin conditions that we'll say plagues everyone, especially as we age, is hyperpigmentation. And especially in the form of melasma, can be one of the most difficult things to treat. And at least in our hands and our practice, it's a multimodal approach, and you throw the kitchen sink at them. How do you combat that in your practice?
Melasma is so tricky. Again, it's like having that rapport with the patient, explain to them it's sort of like a lifelong problem. Not necessarily it's going to be dark forever, but it's something that they have to maintain forever. So I love, the fact that you do it multimodal because there isn't one cream. There isn't one sunscreen. There isn't one laser. There isn't one approach, one peel. So I just lay it on the line, lay it down for them, and explain that, look, this, and I have a handout because, it's like AI now should come in and do our job for us because we're so repetitive all the time. I've been told that if anything you do 3 times a week, you need to let AI help you. So AI didn't help me with my handout. I actually wrote my handout, but I have the handout and I explained, from low investment to slightly higher investment, and then everything in between. I typically tell them you're going to need 2 out of 3 of these approaches.
For sure.
So, obviously it's something topical. I like something over the counter when they're taking breaks from the prescription topicals. I love Lysetta. I like Lysetta orally, even though there is a risk of clotting. Apparently the OBGYNs laugh at our fear of the clotting potential of Lysetta. Okay. But, you want to make sure that the patient understands that there is this risk and make sure they don't have any risk factors.
Sure.
And then I think the peels and the lasers the lasers have gotten better. I don't love lasers for melasma. I don't have a specific one for melasma, so I do more peels and that kind of thing. And I'm paranoid about doing an IPL on somebody because I know it'll bring it out. But the treatments are getting better and better. And I just think that they cannot get frustrated. They have to just keep moving forward. But I also feel like they need better sunscreens and more reapplication because they just don't understand how important that part is.
For us, obviously, we have a special scenario. We ended up opening a regenerative clinic in Mexico. And so we've been starting to use more regenerative therapies, right? And so now stem cell, exosome, so I have a feeling, and I wanted to get your take, but I have a feeling that now we're going to have some new potentials for treating, preemptively some skin conditions. And I just want to get your take.
I think people love procedures, and I think the exosomes are amazing. We don't even really understand the full potential probably yet.
We're not even allowed to use the full
We're not even
potential
allowed
yet,
to
so-
use, right? But I think, as I was mentioning, the tranexamic acid, Lyseta, orally is good, but injecting it is even better. So injecting,
really?
yeah. I mean,
didn't know
you have
that.
to, it's like you do it every 2 weeks, a tiny amount. I can get you the exact amount that you should inject, but it does work and it doesn't hurt. You just use a tiny little, you could do like a 32
In the affected area.
In the affected area. There's no side effect
That's
of like
really
the oral.
cool.
Right. So it doesn't work overnight. Like the melasma, anything does take time, but whether you're rubbing on exosomes or using an ultrasound to help it penetrate or microneedling it in, whatever it is, I think that there is a potential. Cannot hurt. It's going to give them at least better looking skin and more glowy, luminescent skin.
Yep.
Oh, it's just, I think that people just need to, again, hear all the options and then decide what works for them. And if that doesn't work, go to the next and to the next and to the next.
Yeah, I mean, for us, I think it's extremely difficult. We have a special scenario here in Beverly Hills where people want something done in 2 days, no downtime, and have it be a single treatment. And, again,
be perfect.
Yeah, exactly. For us, and you
Yes.
run into the same thing. It's just not possible.
Right.
And so
Not
this
with
is,
melasma.
Yeah, there's some long-term gain investment, we'll say.
Well, and I also feel like everybody's on the same page with melasma. Like I used to battle with med spas and other specialties, but I feel like everybody is on the same page. Everybody's the patient with melasma is going to get a similar consult everywhere because
hope.
we all know. Well, you hope.
You hope.
But I think we
like,
all
I hate
know
when you
it's
hear
difficult.
that the first thing they were given was a laser, and you're like, laser's going to make it worse. Like
Potentially,
And
yeah.
the problem is, some people are like, "What do you mean?" No, yeah, for the person who's treating it, they're going to make the most money. But and it's funny because the first thing I learned about melasma is keep heat-based procedures as your last treatment. Make
Yes.
sure you stay away from it unless it's your last resort. But
Right. I tell my patients with melasma, don't even do hot yoga. Well, I mean,
no,
I'm
for
sure
sure.
you do
Yeah.
too.
Oh,
absolutely.
Yeah.
No saunas, no hot yoga. I
Anything
wore a
heat-based.
hat all weekend. I wore a hat all weekend. I was in the pool with my kids, and because it was hot. You had the reflection. It's so many.
people don't realize it's just regular heat, like from hot yoga. It can do that.
But in general, like the other, you were just talking about pigmentation in general. Melasma isn't the only problem with pigmentation, right?
Very
It's,
true.
Generally speaking, just another reason why I think you shouldn't be driving your convertible is because you're going to hate the pigmentation you're going to get later when you get all these dark sunspots.
For sure.
Dark
I think it's
lenticos.
done anyways because I'm getting.
No, your skin looks great.
I'm getting beaten. No, I'm getting beaten down for having the car, so I have to get a bigger car. So take the kids to school. Before you bring out your fancy gadget, I want to. We have more in common than we think because we both actually started our own skincare line. And I'd like you to kind of tell us a little bit about your skincare line, what it's about, where people can get it. I know it's called SKN, right?
Yes.
And it really is an exciting, it's our baby's Beverly Hills MD. We love it. It's been a 10-year journey and we still are doing it. And really it's like a passion of ours. And I think I'd love to kind of get your take on, everything about it.
Started years ago before any doctor had a skincare brand. So, back to my story of my father being the dermatologist. When I was in med school, I said, you have to have products. So this was 30 years ago. And so we started, just cleanser, sunscreen, a scrub, basically a moisturizer, the basics. And there's power in having something recommended by your doctor that they developed. So, it expanded from there to bigger and better. We had a lot of acne-based products back then. A lot of benzoyl peroxide washes, a lot of salicylic, a lot of glycolic, a lot of very, very light moisturizer. And then, expanded into things that like I really enjoy and need and love, and the technology in skincare has improved too. But I love it because the price point can be much better than some of these higher end lines that we carry, which people love and I love. But like the TNS cream is $299
Right.
or whatever it is. And then there's Skin Better and then Neocures, all these lines that are great. They're so expensive. It's a lower price point. It's much more desirable for the patients. And I just feel like they're taking me home with them. So it is called SKN. We have a lot of people who are using our name illegally, who they will be receiving cease and desist
Yeah.
Don't worry,
letters.
we found that out too recently.
Yes, it's annoying.
The
but
exact
they're-
same
People
line.
love
They literally
copying
took
it.
our line, completely copied it, and called it something else, but the full line, like they were all the same
So
product.
just counterfeit,
Yeah.
like
I look at it one day, I go, someone totally copied all our stuff.
Yeah.
Yeah.
I mean,
Miami.
mine actually isn't counterfeit, although I have had dreams about my skincare line being counterfeited. And I remember waking up thinking,
China.
oh, thank God, that was just a dream. But just, people use the name and it's illegal. Like I own the trademark. So, it's SCAN Beverly Hills. I had a friend who tried to buy it in North Carolina, a friend of mine that I gave it to years ago to as a gift. I was like, I can't find it. There's so many SCANs online. I was like, what?
Yeah,
so many
yeah, yeah.
SCANs online. So then I went online, just didn't punch in Beverly Hills. I just did SCAN. I was floored. There were 7 med spas all over the country named SCAN. So I have to protect my,
Sure,
my trademark
exactly.
and my product line, and I all the things that we see in derm: acne, melasma, dry skin, xerosis, itching. We cover rosacea. We didn't even talk about rosacea. Oh my God, it's another podcast.
No.
We have something that I over the years have loved and has worked for, whether it's me or from other patients, and we've just formulated into products that I think will work for the patients at a really great price point.
It's very similar to, I guess, how we do ours, because our whole theory of how we came up with our skincare line was, let's try to give a little bit of Beverly Hills outside of Beverly Hills for people who can't come here, can't
Correct.
afford it, so they can feel like they're getting the same type of luxurious Hollywood-based treatment, but at a fraction of the cost. And it really is. It's a real feel-good kind of journey we've been on, because we get letters from all around the country.
Right.
People are really happy. They love the products, but it's not breaking their bank. So
Exactly.
see,
Right.
we have more in common
and
than
as
I
and
thought.
as you sort of hear feedback from them, luckily nothing negative. I can't believe nothing negative has ever happened, because everybody
Yeah, of
is
course,
different.
yeah.
But as you hear feedback from people about certain products, like you can develop and change or improve them if needed.
And we continue to do.
Well, that's the funny part, is we always said, how lucky are we, because we have access to 100 different skincare lines. And then you hear patients and they say, this works. You look at the ingredients and you wonder, okay, wait, maybe we can do something and make it better. But it's great because we know what works, what doesn't, what can be harmful. And
Yes,
so,
right.
that's the
And they trust you, right? I don't know, patients, who are purchasing your product line, who have never seen you, trust you, but also your patients who actually come in and have
Definitely.
procedures by you. They'll take whatever you say because they've developed a rapport with you. Same with me. I spend so much time with my patients. I feel like and I love when they bring their products in too, and I can say to them, this one is great. Do you like that one? It was only $8. Yes, I like that one. That's fine. This one I don't like. So it's also nice to go through the products with them.
Definitely. I agree, because you don't want to necessarily push something on them. You want to pick out what you think is going to be important and helpful for their skin.
Yeah.
So, the interesting part with skin is we could talk for days from autoimmune diseases to, and I think we definitely want you back for another podcast, because
Just on rosacea.
Yeah, just on rosacea itself.
Seriously,
Rosacea and why what we send to you guys. Do you want to talk a little bit about who?
Yeah,
what
that's
kind of
why.
agent we
That's
send
honestly
to-
one of the reasons I admire you so much, because you're a doctor who's never ever afraid of saying, "This isn't for me. I don't want to deal with this. It's something that I think someone else can manage better." And I love that, because it's something that I've always kind of taken pride. We have. If someone comes in here and it's something way above something that I can take care of, I'll turn around and be like, listen, there's a better reconstructive surgeon that does this all day long. Go to him.
Great.
And over the years, you've turned around and said, hey, here's a big lipoma, or here's somewhere that's a little more cosmetically that, maybe you guys can do better. And there's so many, all your patients are lovely, but it makes me feel good because it's not like that in your field. Most dermatologists are like, we can do everything and anything, from liposuction to tummy tucks to,
Blefts.
to blefts.
Yeah. And I noticed the trust they have in you. That's the phenomenal part. And so, that is, it's kudos to your practice and who you
Thank
are.
you.
And so,
Thank you.
I told you we should have one of those, like, what are those fire poles that just goes from your office to
Yes.
ours,
Oh,
and
I
you guys can
love
just
it.
drop right down.
Yeah.
I think my office is literally right above
Yeah,
there.
It
or an
is.
eject button
can-
for people you don't want. They just like
climb.
boop, they
we
fall
could do
down
it.
here.
We found the spot that we could drill.
Hilarious.
So
Hilarious.
Yeah.
I think that I'm into it. But let's not tell our landlords.
Don't tell anyone.
No.
Can we check out
It'll
the
be part of
gadget?
the remodel here.
Okay, yes. So I brought the UV camera.
Oh, we're in trouble.
There's a sunscreen called Pavise, which is such a beautiful story. She's a Harvard business grad from China. She graduated Harvard Business School and decided that she wanted to cure cancer first. She decided that was her goal. And then she realized that was going to be a real daunting task. So she decided, I'm just going to make the best sunscreen in the world. And it's called Pavise. It's very expensive. It's like $130.
Wow.
But it's basically diamond core technology, diamond core zinc oxide, where it's like microscopic pieces of diamond that actually encapsulate the zinc oxide, so it keeps it very stable. It's not diamond, so it's fancy. It's diamond because diamond is very stable. And she also comes, when you buy the Pavise, you can also purchase the camera, and you could see if your sunscreen is basically on correctly and how long it lasts. And when you use the Pavise sunscreen, it's like mud on your face. So I did use it this morning, and so it's mud. When I look in my camera, I have mud on my face. Let's see if you guys have mud on my face. Oh, there we go. See how it's like mud?
Oh, yeah.
Let's see if, let's make, yeah?
He looks like that guy from the movie.
You can see right where I've shaved all the way across. That's so funny.
Is it supposed to look super dark?
Well, so when your sunscreen is on there, it's supposed to look super dark. If you don't have sunscreen, if you've missed a spot,
I look
it'll
like I'm
look
150 years old.
No, the UV camera definitely makes people look a little weird. But it doesn't have to be the Pavise sunscreen. It can be your everyday sunscreen.
If you notice, he's much darker than I am. I'm like much lighter.
Do you have any sunscreen on?
Are you kidding me?
Yeah.
But if you were to go like this with sunscreen, you'll
see the dark.
Yes.
That's
and
really
then
cool.
2 hours later, you check and you see if it's still on there. And most sunscreens are not on there.
Wow, that's amazing.
Right?
Love
and
that.
you can buy UV cameras online. They're not expensive.
Yeah.
And you just have to, this is their line, their app, whatever. But I love it because I show, in the consult, if patients are coming in for just a general consult, I'll put this on them, and if they've told me they put sunscreen on, usually after 12 o'clock, so in the afternoon, when I see the patients in the afternoon, they don't have any sunscreen on them anymore.
Wow.
So when they
That's
drive
great.
home, when they're driving in their convertible, or when they're like working by the window, they're getting a lot of UV rays.
Yeah.
That's a very good point.
Yeah.
Well, I wish we
like
could
it.
sit here and talk longer, but for our viewers and listeners, give us just your top 3 take-home tips as a dermatologist.
Full body mole checks naked with a good dermatologist or good derm PA or good derm NP that looks through your scalp and in between your toes and tells you to get your eyes checked and tells you to make sure to look at your private parts for things if you don't want them to see it. Sunscreen and sun avoidance and protective clothing, please. Hats, long sleeves. Otherwise, they're going to be seeing you for full body resurfacing eventually. If you're scared about a lesion, get it checked early.
Yeah.
Don't wait. If you have acne scars, don't wait. Get them evaluated early.
And where can patients find you? I know you have Instagram and everything else, but what's the best way? Because I know there's 2 offices. And
I mean, you can look up Rapaport Dermatology online. It's rapdermbh.com. Rapdermbh.com is our website. But if you just, Google Rapaport Dermatology or Vicki Rapaport, we have offices right above you, literally right above this beautiful office. And then we also have an office in Culver City.
yeah, and if you ever call us for referral, it's always Rapaport Dermatology. So
Yeah.
it's that easy.
And I'm pretty booked up. I definitely don't work 5 days a week. I went down to 4 days a week, and now sometimes I'm working 3. So I'm booked. But I do try and get people in, and I have really amazing PAs that have been trained by me. But, if patients get very turned off by the fact that they can't see me in 3 months, they just have to keep calling because we have, patients changing their schedules.
Sure,
We
of
have
course.
openings. The staff will get to know you. Just, if you really need to see me, just say, I need to see her. Please get me in. And they will get that.
No,
They will
you're the
get them
best.
in.
We know that.
Awesome.
Thank you.
If you like this video, you're going to love this one.
The one thing I always tell every single patient that comes in here, the best way to tighten skin is to remove it.